All right, we'll begin our discussion on the second part of the cardiovascular system, looking at the blood vessels. So there are three major blood vessel types in the body: arteries, capillaries, and veins. We talked about these in lab. Remember that arteries carry blood away from the heart. Typically they carry oxygenated blood, except for the pulmonary artery and the umbilical artery of the fetus. Those are exceptions to those vessels carrying deoxygenated or less oxygenated blood. The veins carry blood toward the heart, and they typically carry deoxygenated blood, used blood from the body, except in the case of the umbilical vein and the pulmonary veins. Those both carry oxygenated blood to the heart. And capillaries are the sites of exchange. We find them in between arteries and veins. That's where things can leave the blood and enter the tissues, is through the capillaries. Think of the arteries as exit and entrance ramps from the capillaries, where exchange can occur. Or arteries are the highways, sorry, and the exchange occurs outside of the highway, off the exit and entrance ramps. So if we look at the structure of the different blood vessel walls, we'll see some differences based on their functions. But what we can assume is that there are three layers of the vessel wall that have the same name in both arteries and veins. We have the inner layer called the tunica intima, we have the middle layer called the tunica media, and the outer layer of the blood vessel called the tunica externa. However, in capillaries, these are single cell vessels, so they do not have all three layers. They have one layer, which is called the endothelium, that inner lining of the tunica intima. So one layer of cells in capillaries, which is, remember, is formed by simple squamous epithelium. So here's a nice diagram from your textbook showing the differences between the different vessels. This is an artery here, this is a vein, and then we see the capillary down below. So your heart pumps blood through arteries. Remember, the aorta is the major artery to receive the blood coming from the left side of the heart, the left ventricle. So arteries are much more muscular compared to veins. If we look at the layers here, this inner lining here is the tunica intima, which is made up of simple squamous epithelial cells, very shiny, slippery surface. We saw this when we dissected the sheep heart, of what the endothelium looks like in the heart. So this is one layer of cells here. It's called the tunica intima. And then we have the next layer, this thick muscular layer here, made up of smooth muscle cells. This is called the tunica media. It's the muscular layer that generates the pressure for blood pressure. So again, the tunica media made up of muscle. And then the outer layer is the tunica externa. This provides support for these vessels, anchors them down in the tissues, mostly collagen fibers we see here, as well as smaller blood vessels called the vasovasorum, but that's not as critical for you to know other than the collagen fibers. And recall when we talked about the blood vessel or blood clotting and hemostasis, that those collagen fibers are what can initiate the clotting cascade and platelet aggregation or platelet stickiness. So do remember that there are three layers that form the blood vessel walls in arteries and veins, and how they differ. So if we compare that to veins, notice the lumen, this inside space, is much larger compared to arteries. So the veins can hold a lot more blood than an artery can, based on that large internal diameter, the lumen, the space inside. But if we look at the muscular layer, the tunica media, notice how much thinner it is compared to arteries. So veins have a little bit of smooth muscle, but not nearly as much as arteries do. So these are not the high pressure vessels as we see in arteries. Arteries are high pressure, veins are high volume. So we call these the capacitance vessels, because they can hold a lot of blood because of their larger lumen. It also has the tunica externa, not much difference between the two vessels in terms of that. But also there's a special structure in veins that helps return blood to the heart because of this relatively thin muscular layer. Veins have valves, and these valves prevent backflow of blood. It keeps blood moving forward through the veins toward the heart. And there's a couple of things that influence that venous return, or return of blood to the heart, and we'll talk about that when we get a little bit later in this discussion. So if we look at capillaries, again, we see one layer of cells, endothelial cells we call those, and not much different than we see in the arteries and veins in terms of the types of cells. It's simple squamous epithelium. But there is no muscular wall, there is no tunica externa. We just see the simple squamous epithelium. And again, these capillaries are the sites of exchange. So these arteries will branch into smaller vessels called arterioles. And then when we actually reach the capillaries in the middle here, this is where things can come and go from the tissues. And so things can leave and enter the blood at the sites of the capillaries. Once they enter the venule and then the veins, nothing can come or go from that blood. It's just on its way back to the heart or kidneys or liver, depending on what the function of that particular capillary bed is and where it's located. So if we look at, again, the connection here between the arterial system and the venous system, we can see the heart pumps the blood under high pressure. There's different types of arteries that we see as the blood leaves the heart. We have elastic arteries at the beginning of the circuit, which turn into muscular arteries that play a large role in controlling our blood pressure. And then sometimes we bypass all the tissues and go right back to the heart via the veins, or we lead to the capillary bed. And again, our brain, our organs, our muscles all have capillary beds that supply oxygen and nutrients and pick up wastes from the cells in that tissue. So this is where the exchange, again, is occurring. And we can control how much exchange occurs by these special sphincters that can tighten and basically there's smooth muscle that can constrict this passageway and bypass the capillary bed completely and head back toward the heart. So we see this, for example, when the sympathetic nervous system is dominating, the capillaries serving the digestive tract, for example, would not be active, and we would see a constriction of the precapillary sphincter, and we would see a bypassing of blood through the digestive tract and working bypassing and sending that blood to the muscles for the fight or flight response. So again, looking at arteries then, there are three different types of arteries. The elastic arteries are thick-walled arteries. An example is the aorta and all the branches, major branches of the aorta. So these are very large arteries. They don't constrict and contribute a lot as blood pressure regulators, but they receive the blood coming from the heart, so they are a reservoir for pressure, so they can expand and recoil to receive the blood from the heart. And then it just allows for a smoother pressure downstream if these can kind of balloon out as the heart contracts and then recoil as the heart relaxes again, and allowing a good supply of blood entering into the muscular arteries. So the muscular arteries are the ones that receive the blood from the elastic arteries and are actively controlling blood pressure depending on the needs of the body and where that blood is going, whether we're having parasympathetic nervous system domination or sympathetic, or a balance of both, which would be happening if you're in homeostasis and just going about your day, walking, moving around, whatever. So anyway, we see that thick tunica media, a lot more smooth muscle because it's actively controlling blood pressure. So as the tunica media constricts, that's going to push blood into the tissues and allow for good oxygen delivery. So to a point, of course, if we have too much vasoconstriction going into a capillary bed, that can prevent blood flow. So we're talking about enough vasoconstriction to provide enough pressure to squeeze the blood out of the capillaries into the tissues and delivering the oxygen and nutrients that are needed there. So the arterioles are the smallest of the arteries. These are what leads directly to the capillary beds. And like I said, these can be influenced by other factors in the body where we can control those precapillary sphincters in the arterioles and reduce blood flow. If, for example, a person is jogging in a marathon, they wouldn't want a lot of blood flow going to the digestive system. Or if a person is under a great deal of stress, we're not going to see high blood flow through the arterioles to the capillaries of the digestive tract. Those would be directed toward the muscular system or the muscles, capillary beds of the muscles. So this just gives us a kind of a visual of the three different types of arteries we see. Notice that they all have, a fair amount of endothelium, but the biggest difference is the amount of muscle they contain in that tunica media. So these are the most common arteries we think of when we're talking about blood pressure control and feeding the tissues. We're looking at the muscular artery, and this is what is influenced when we look at factors that control blood pressure in the body. So it's the muscular arteries. So capillaries, like I said, are where the sites of exchange occur. So gases, nutrients, wastes, hormones, all the things we need, all of the things our cells need to maintain homeostasis is delivered through the capillaries. So these are such small vessels that only single red blood cells can pass through these at a time. So anytime we would have clumping or a clot, you can imagine how that's going to affect blood flow because these capillaries are so very small. But the good news is we have many capillaries. There's a huge surface area of exchange here because there's many capillaries that branch from that arterial. So here are the three types of capillaries we see in the body. We have some capillaries that do not allow a lot of exchange. So we see these in the skin and muscle because we wouldn't want a lot of exchange going through our skin because remember the skin is your protective barrier and prevents, water loss and electrolyte loss. So it would be important for us to have continuous capillaries in the skin. So we can see there's some cells associated with the outside wall of these capillaries, which are called pericytes. Peri meaning around, cell meaning, or site meaning cell. And these just prevent too much loss of fluid within the capillary and nutrients into the tissue spaces. So these are the least permeable, the continuous capillaries. A fenestrated capillary is where we're going to see more exchange occur. And this would be important in the kidneys because the kidneys are an important filtering mechanism for the blood. So we would expect to see more exchange between the capillaries and the tissues. We know that the small intestine is an important site of digestion and picking up nutrients from the digestive tract. So we would expect to see these capillaries to be more leaky in terms of allowing more exchange. So these holes we see here are called fenestrations, and they're just simply holes or pores where there can be more exchange between the blood and the tissues. And the most permeable are these very large pores we can see here. These are the sinusoid capillaries, and anywhere where we're allowing a lot of exchange between the blood and the tissues. For example, the bone marrow we know is constantly producing new cells and delivering that to the bloodstream. So those would have to be very large holes to allow those cells to enter the blood from the bone marrow as we're creating more bone cells. We know that the spleen is a reservoir for red blood cells, so in order for those red blood cells to leave the spleen and enter the blood supply, those would have to be large holes to enter the blood supply. And the same thing with the liver. We know that the liver is a site of exchange and also makes many proteins that are important in the plasma. So in order for those large proteins to leave the liver and enter the blood, we would need large capillaries to receive those important components of plasma. So again, capillary beds, we call that the microcirculation. It's just the circulation that's occurring between the arterioles and the venules leading to those capillaries. So I have a animation we're going to look at here in just a minute. But again, we have those precapillary sphincters to regulate blood flow into the capillaries to make sure that we are maximizing blood flow to where it's needed. For example, if we're running away from a bear, we would want to make sure we have good blood flow to the muscles. If we're sitting down and relaxing watching television, then we might increase blood flow to the digestive tract to allow us to digest our meal. So it just depends on the needs of the body where these precapillary sphincters are going to be controlling blood flow. So here is again what this would look like. So here's your vein and venule. Here's an artery and an arteriole and the capillaries in between there. We have one thing that is called a meta-arteriole. Remember, meta means middle, so think of it as in the middle of the capillary bed. And let's say, for example, we are in a stressful situation, the sympathetic nervous system is dominating, we would not want blood flow to go to our digestive tract. We would want to allow that blood to bypass the digestive tract and go right back to the veins and return to the heart. So this is where we can see these precapillary sphincters would constrict, and the blood would flow through the meta-arterial right back to the veins to take that blood back to the heart. So the tissues of the digestive tract here would not receive any blood at this time. I mean, of course, can't happen for a long period of time because the cells of the digestive tract would die, but we do see the ability to bypass a capillary bed if the needs of the body are changing and that particular tissue isn't needed for, it doesn't need a big blood supply at the time. So the venous system, venules, receive the blood from the capillaries, and if we look at the capillary beds, or the venules that leave the capillary beds, we can see that they allow fluids and white blood cells into the tissues, and they consist of that endothelium, but they become larger as we get further from the capillary bed, and they eventually form veins. So here's an example of what capillary blood flow would look like. This is an actual animation from the body showing how these capillaries flow these red blood cells flow single file through the capillaries. So here we could imagine this is probably a capillary. We can see how slow the red blood cells are flowing, but then once they get to the end here, they're quickly whisked away. So this is a venule then, where there is no more exchange, and it's quickly sending those red blood cells back to the main circulation. But here we can see that there is rapid flow, so there's no exchange occurring here, but where it slows down, that's in a capillary where we're going to see exchange between the blood and the tissues. So this is a great animation showing blood flow and how those red blood cells flow through single file through those tiniest of capillaries. PowerPoint, get to the right one here. So that was the capillary flow, and you can watch that again on your own if you'd like. So looking at veins then, so once we leave the venules, that blood enters the veins. And veins, like we said, have larger lumens, thinner, less muscular walls. So thinner walls, larger lumens, and a much lower blood pressure because of the thinner muscular wall. There's not much blood pressure. These are, again, the capacitance vessels, which means they have a high capacity to hold blood. So we call them the blood reservoirs. But recall that because they are capacitance vessels, recall that from the blood unit that anytime blood sits or pools, it has a tendency to clot. So we really have to be careful that we don't let the blood sit in the veins too long by allowing sedentary patients after surgery, for example, to not move around and get that blood moving, because in the lower extremities, like in the legs, we see a higher risk for blood clots developing in the veins. But because of this large lumen, they hold up to 65% of the blood supply. So most of our blood is in the veins side of the circulation. So here's just an example of that. We can see that most of the blood is in the systemic veins and many of them in the arteries. So you can see that a lot of that blood is pushed, to the circuit through the arteries and arterioles, and then much of it is in the veins at any one given point in time. So we talked about the differences in the vessels between arteries and veins. Remember that the veins have those valves to prevent backflow, and we see those particularly in the veins of the limbs because they are subject to gravity when they're hanging downward. So we see veins as important factors in getting blood back to the heart. And then we have special veins that have very thin walls that are influenced by the tissues around it, and that's the venous sinuses. We talked about the coronary sinus on the surface of the heart as receiving blood from the different veins, cardiac veins on the heart. And there's also one we find, the dural sinuses, lying over the brain under the dura mater. So if you've heard of someone who has varicose veins, that's because they have valves that are leaky and blood is flowing backward in those veins rather than forward, and it causes those veins to bulge out. And typically we see these in the superficial veins, branches of the major veins in the lower extremities. So we see these little bulges in the legs. And what they'll actually do to treat that is they'll destroy the vessels. They'll just either inject a chemical or use a laser and actually destroy the veins, those superficial veins. And as long as the deep veins are intact, these superficial veins with the leaky valves are not really important for blood flow. So this is just kind of summarizing the three different vessels in terms of the venous circulation. So if you look at the capillaries, again, we don't see a lot of other tissues other than the endothelium. The venule has a little bit of muscle to it, so we do see some smooth muscle around the venule, but not a lot. A little bit more in the veins, but again, very large lumen and ability to store blood. So if we look at a tissue slide of an artery and a vein, which you would see in lab, you can see this thick, muscular, smooth muscle wall here, and you compare that to the vein, much thinner. But look at the lumen. You can see there's not much space here, and there's a lot of space here. So we'll stop here and continue with our discussion of the vessels in the next video.